And so we do one. That means somebody else is coming. Oh. Anyway, one quick interesting thing. We'll start with Mary, just like a quick and no explanation, really. I mean, a little bit, but you know.
I'm Mary. I'm with the Central Oregon Health Council. I have a 3-year-old who wants to be an astronaut. So I recently have gotten really into the stars and learning about planets.
Fun. Gary?
Well, when I go tuck my chickies in at night, I look at the stars and they are phenomenal. And right now I've got babies, so that's my life.
Chickens?
It's my baby, yes,
Nice.
Correct.
Hi, I'm Tom Kuhn. I coordinate the Public Health Advisory Board, and I'm also the project manager for the public health section here at Health Services. And I've been with Health Services almost 16 years. And my interesting thing is I bike commute year round.
Year round.
Unless it's icy or snow, I'm biking.
We're riding.
Still rides in the snow and ice, so it just depends. I've seen you out there.
Yeah, it's just got to be really. Yeah. I'm a little more cautious after a couple spills.
Oh, yeah. I've seen you out there, and I'm like, what is he doing? But
Yeah. Only 2.5.
good for me.
I mean, some
Last month when I stuck my head in here, it was a whole different crowd. So it's slow today.
that's
Colleen?
Hi, I'm Colleen Sinski here because I serve as the chair of the Public Health Advisory Board. Outside of that, my real job is I'm the director of Central Oregon Fuse, local nonprofit that is working on addressing chronic homelessness with supportive housing. I need to get used to saying our new name, Fuse Housing Collaborative. And my fact about myself is that my partner has been a longtime therapist here at the Chief County Behavioral Health on the adult outpatient with the Cosmos team. So we have a lot of interesting dinner table conversations. But yeah.
So I'm gonna skip up to you on the screen because physically you're in the middle, Linda. How about you?
Hi, thank you. I'm an adult foster home provider since 2012, which is 14 years. I love to make soup, and the soup of the day is lentil and curly kale with warm spices topped with coconut cream.
Hi, I'm Dana. I'm the administrative assistant for behavioral health, and not necessarily an interesting fact, but it's been on my mind. I love to travel and I love building itineraries for traveling, so I'm gonna start planning my next trip. I don't know what it is yet, but I get really excited about it.
Good.
Hi, I'm Shannon Brister-Ragus, the behavioral health director with Deschutes County. And I also love to travel, but not with an itinerary. I'm kind of spontaneous, and I want to talk to the Uber driver or the taxi driver to know where they eat locally and like off the wall things. So I'm going camping tonight. I got my trailer already hooked to my truck outside and I'm ready to go. So that's my favorite. And I'll look at all the stars.
I build in downtime. It's cool.
Commissioner DeBone?
Tony DeBone, Deschutes County Commissioner. It's all about Dutch oven for me right now.
Oh,
So we're gonna have a Dutch oven cook-off at 4th of July at Frontier Days in La Pine. And I'm backing my way up to invite community members to, you know, kind of practice cooking, come up with a recipe, get ready for the 4th of July. So not this weekend, but next weekend, we're gonna have do some cooking.
that's fascinating to me. How many coals you put on top.
Oh, yeah,
My mother
it's a science.
it's a science, and yeah, it's fascinating.
What are you gonna make?
Chuck roast onion stew. Yeah, so I'm working on it. I'll probably make it a few times before the 4th of July. So.
Yeah, practice. Thanks, perfect. All right, well, I'm Melinda Thomas. I'm one of the co-chairs of BHAB with Lee Butler, who will be joining us. I'm an attorney for the High Desert Education Service District, and so I represent local school, regional school districts, and I focus a lot of my work on special education. And so my one interesting thing is going to riff off of yours. One of my clients is Crook County School District, and the superintendent a couple of years ago and I were smack talking about our potato salad. And so we started this cook-off competition in Crook County School District, and it's mostly their staff, but myself and one of my colleagues goes, and I was the inaugural winner of my potato salad. So haven't won since. But it's all about the bacon for me. So Anyway. All right, and I think that the reason that we have low numbers could be because there's a new login for our meetings today. And so I'm wondering if some people are are trying to use the old one. And so we're gonna move along. I'm not going to call for a vote to approve last month's minutes because I don't believe we have a quorum right now. But if people join a quorum, then I'll just insert that into the agenda. And so at this point, I want to turn it over to Shannon for director's report.
Sort of status quo, we are finishing up our budget, and we'll do budget presentations. And that'll be across the board, public health, behavioral health, IDD. Those will become public in May. For the behavioral health side, we're looking pretty decent. We're in a lot better shape than a lot of counties throughout the state. It's still definitely difficult. We are seeing increased demand from OHA and less resources. So there will be shifts in terms of positions and how we approach the work that we do. And Commissioner DeMone's going to go over like our overall kind of budget approach. So I won't go into that too much, but basically we have what are called core services, mandated services, or safety net services. And we do a lot in Deschutes County that are not part of the three of those things. Those are the three things that we get funded for. And we rely heavily on grants, or we rely heavily on our contracts and CCO negotiations with Pacific Source to fill those things that we're asked to do that are above and beyond our mandate. So depending on how things go in the next year, we will see what adjustments we have to continue to make. There's lots of proposed changes at the federal government level with HR 1 that could impact our Medicaid clients, but we are well positioned right now to support the needs and then kind of just wait and see. We've had quite a few strategies out there. One of those is working with our CCO on a contract renegotiation. That is very much in the works, and depending on the outcome of that negotiation, we'll have some pretty significant impacts one way or the other on how we move forward. So for right now, I just want everybody to hear that we have a budget. It is balanced at this point. It will move forward, and we'll just continue to monitor it. One of the strategies that we have to helping with our budget and helping offset some of the challenges within our community as we've been working with MTM. I think we've spoken to you all about that. MTM is a national company that looks at how agencies support people into coming into care, receiving care, and transitioning out of care. We have about, so once somebody comes in for an access appointment, we lose about 43% of those clients between their first treatment or first access appointment and treatment. The reason is we have the ability to meet timelines to get people in the door for their first assessment. After that, into ongoing appointments, it tends to get bogged down. So that tells us a few things. It tells us either we don't have enough staffing, or we're not moving people through care, and our back door is not as open as our front door. So centralized scheduling is going to help us where we use a lot more admin support to make phone calls, make appointments. We free up our clinicians' time. On average, clinicians spend about 2.5 hours a week scheduling appointments. That's not a good use of their resources, so it will help with that. It also brings in an engagement specialist for people that are chronically no-showing. We want to see people who are waiting and want to be seen, right? Versus people who have appointments and aren't coming. There might be some clinical reasons why they're not coming, so there's a balance to that. But having processes where we can see people who are waiting to be seen. So that is coming. We hope to start that in June. It will be a complete overhaul on how we engage our clients and services. After that, we will start doing open access for individuals that want to just walk in and have receive services, which is something we've not done in the past. And that relies heavily on managing those no-shows. So if someone no-shows, then there's someone there that can be seen. So that's coming, and that is gonna be part of our effort when we have less resources and more demand for services. One of the last things on budget that I'll just mention, it's been in the news, but cuts to Measure 110, or what we call the Behavioral Health Resource Network. We did lose about $700,000 in burn funding. It will have an impact. Matter of fact, I'll give commissioners an update on April 1st, but it will have an impact on how we manage those services. The irony of Measure 110 is it dependent upon marijuana tax. So if people aren't purchasing marijuana, then our dollars to support people using marijuana go down, which is kind of interesting, but also it is what it is. So we have a number of CADCs, so drug and alcohol counselors within Deschutes County. We still have resources to provide the care, but we are going to take a hit in that area. That's coming to you all to present. So that's it for me. Lots going on, but I feel pretty good about where we're at right now.
All right, before we move on to the next agenda item, we have somebody join. I'm guessing your name is Gwen.
Yeah, I am Gwen Jones. It's nice to meet you. My pronouns are she and her, and I'm with, hi, Colleen. Familiar faces I haven't seen in such a while. Tom, with Central Oregon Health Council. I'm Director of Community Strategy.
Okay, so we do one interesting thing. So is there something interesting you can share with us about you? It could be that you traveled, you cook, you're an artist, just that's something that we typically do.
Yes,
It's quick and you don't need to spend a lot of time on it.
very good. I do aerial arts and silks.
Oh.
So I left my phone there this morning, so if anybody tried to reach me, I have not found the message.
Well, thank you for joining us.
Glad to be here.
Glad to have you. Okay, so moving on, Commissioner DeBone.
I think Cameron Fisher joined us.
Yeah, I see that, so we are getting closer.
Do you want me to do that budget item now that I had talked about last month, or?
I would love to have you do that.
So, update from Commissioner. Last month, we were speaking about, what, just the big picture. I thought, everybody should understand how our budget works, how it's easy it is to find some facts. The big picture is what we're presenting here. I printed that out and put some notes on it and left it on my desk. So I don't have the copy I thought I was going to have today, but we can talk through it. Deschutes County, we have a budget committee, 3 public members, the 3 commissioners. We're going to go to 5 after we go to 5 commissioners. So we'll have 10 on the budget committee. It's broken up into chapters. This is the published annual budget. This is the chapter for health services. As I said, if we don't zoom in, I'll just have to talk about it a little abstractly. I don't know if you. It says like $93 million up there in the top right corner of there. It also says interim director Holly Harris, but she's been appointed the director now. But as I say, for each part and piece of Deschutes County, we have one of these chapters, and it works out to income and expense with the pie chart. There's a org chart, a couple of pages in here. Organization of how it's set up. Health department is 400 something people total.
395 now, but.
Oh, okay.
Next time it was for 18, yeah.
There you go.
There you go.
Behavioral health, public health kind of breaks into the 2 parts. Behavioral health at a concept is mental health and addictions, but it's not that simple, obviously. Intellectual development disability, IDD is in there also. Big money, is what's going through here. We want to provide these common services. As I say, if you maybe just walk through, because I've looked at it in detail, but it'll help me, just walk through the pages if you can, even if we can't read it. So as I say, this is the chapter for the health department. So there's a couple bullet points for behavioral health and a couple bullet points for public health, and it explains it. And it really is valuable. As I say, I'm speaking to Behavioral Health Advisory Committee, Public Health Advisory Committee is also the parallel here. But it's good, and I emailed it out yesterday, I think, yeah. Just to flip through it, so good, next page. And then the success and challenges. So this is what's published in front of the Board of Commissioners, the Budget Committee members, provided by the department. In the proposed budget, we have, what's being presented to us. And then, as I say, the adopted budget is after we either pull something out and discuss it or approve that section of the budget, because it all rolls up in the end. So it's so informative, and it's such a nice, easy way to get a feel for the whole big picture about what we're doing here. Next page, please. Keep going here. I'm just looking for, I think, the org charts next. There you go. So as I say, this is an eye chart today, but you can see how it breaks out, and some of those will map directly to those little bulleted items explaining what the services are and how it all works. The health director, behavioral health, public health, administrative services, facilities, just kind of how the organization is set up. So as it says, as advisory committee members, we're coming up to the budget process here pretty soon, and it's valuable to have anybody that's following this topic. I mean, I'm here at the table with us, but now we have emails too. We can email the whole group and say, oh, hey, what about this or what about that? A lot of these dollars are coming from state and federal contracts, though. It's not even general fund, because the general fund is the most flexible investment we can make. But basically, we're just shaving the edge off of some of these things because the money is so much bigger that's coming in from the federal and the reimbursements and the Medicaid and how that all works. So, but the more informed we are as a committee of behavioral health advisory citizens or life experiences, because I mean, if something comes up here, comes to me, I'm sitting right at the table for the budget, and we could say, well, we need to spend that extra $20 here or whatever. Next, as I say, I had to highlight it a little bit here. Okay, yeah, so this is a reminder that, we saw the pie charts, income and expense. You can roll up anything into a simple pie chart. This talks about a little bit more material services, employment, overhead, transfers in, transfers out, general fund support, as I say, the structure of behavioral and public health with interfund charges back to the administrative subsection of the health department. So how we keep all that in track. So it's pretty interesting to go. But this is just a simple high level view also. We also have a line item budget. So if you want to know how much we spend on pencils for some department, you can get to it pretty quick. And I'm serious. I remember when I first got started, somebody called me and they were just hot on something. And not that they were mad at anybody, but they're like, what's going on here? And I was like, I don't know. Let me look into it. And I traced it right back to the budget, right back to the pie chart. And then it got down to this thing. And then it went to the line item budget. And then I was able to explain it, how the money is flowing, and then showed him some of this information. He's like, well, that seems reasonable. I mean, it was so valuable to be able to explain what we're doing and why we're doing it. So that's my experience. Next. Yeah, so I think this may be it. So this is, notice there's only about 8 pages for the whole health department at the high level. And then you can dive deeper and deeper into everything. So that's really what I wanted. We talked about this last month and I just offered to bring it. So that's the high level overview of what it looks like, what it sounds like from me as a commissioner. This has been provided so you can go look at it, in detail and zoom in, because I guess we can't do that right now, but any thoughts or questions? Because I think we have about half the people here we had last month. So
I would just say that each department in there, or each person that reports to me, has a breakdown of what he's talking about, drills down. And every month or every other month, depending on department, they go through that line item. Today we looked at an invoice for a $38 charge. So, and we were like, oh, there it is. Why, what is that right there? Because it was in actually the wrong spot. And so you can tell when it's in the wrong spot. You look at it and you're like, oh, and actually that should be reassigned there, or no, that is actually right. And it does belong there. To a $75 charge for landscaping. Like, you can see it all broken down, and the managers and supervisors go over that every month or every other month, depending on the complexity of their budget. So the intensive teams are the intensive adult services and intensive youth services have the most complex budgets because of the way they're funded. And behavioral health itself doesn't get any general fund. IDD gets some general fund, and then public health gets some general fund. So these resources are, like Commissioner said, coming from Medicaid dollars, grant dollars. They're coming from Pacific Source contracts. Yeah, they kind of come from all over, and each of those has a book of rules on how we can spend those dollars. So everything's pretty well tracked. And what I have right here, you can't have, but it's what he's gonna get.
Oh yeah, that's the preview for next year, yeah.
He's gonna get, coming up, maybe you might have a zinger for me, so I.
Oh, yeah, no, as I say, I mean, well, but once we have the high level view here, if we go down a path as a group, then we can start asking some, more informed questions, not troublemaking questions, but more informed questions,
So this one should be, public, I don't know, as soon as you all approve it, but it's early May.
It'll be in the proposed budget. It'll be released as a proposed budget that the budget committee reviews. And then after we spend 3 and 4 days going through all the different parts and pieces. And then when that gets, the very last thing we do is vote. And sometimes it's 3-2 or 3-3, 4-2 on some of these decisions. We're not always on the same page. But then that's the finalized budget that gets published. Well, no, in fact, after the budget committee, it goes to the board of commissioners for the 3 of us to vote on. So then it could be 2-1. But usually by the time we've already had our little discussions about pieces we may not agree upon, because the final package is usually just the published budget at that point for July 1st.
Simple.
Yeah. I have a question about your budget committee, how it's formed, who's on it, what are the terms? Can you tell us that? So we can relay it to people in the community.
Yeah, well, as I say, we're going to 5 commissioners. May 19th, we'll have 2 new seats on the ballot, but January 1st next year is when we'll have 5 commissioners. So even though we're going to be voting, May, we have races that are going to happen in November. So the top 2 from these races go to November, and then January 1st, or the first Monday of next year, 1st, 2nd, 3rd, 4th, will be the 5 seated commissioners. And then one of the tasks will be to add 2 public budget committee members after the 1st of next year. So those will be new seats. We have 3 now, and we basically just do a 3-year rolling appointment process. So there's 1 seat coming up every year, and it's the will of the majority of the commissioners. Usually not too controversial. We have policy discussions and we get passionate about things, but we haven't really had much of a controversy about the good people in the community that step up to be on the budget committee. But I mean, elections matter, so the mix could change relative to who's in office next year. So then it just opens up, as I say, we take 2 different modes. Either the person that's serving, if they're just finishing up their first 3 years, they're attending all the meetings and engaged, we'll say, well, do we want to keep this person? So we might not open up a recruitment. Or if 2 of us are like, yeah, how about we open up a recruitment? Or, this person, because we had a budget committee member walk away last year, so it was just an open seat. So then that happens also. So everything's possible, but it's just paying attention to, hey, if you want to do that, keep your ears open, because once in a while we open it up.
What do you look for?
Just life experience, really. It doesn't need to be a CPA or certified anything, just life experience, wanting to serve the people, because it's the big picture. It's not just health, it's the whole gamut of what we do. Somebody that wants to be able to commit. It's basically 4 days of these board meetings once a year, but a couple of other meetings, plus you'll get that monthly reports of the status of what we're doing. Because when you publish an annual budget, we have monthly updates. 3 and 6 months into it, each department will say, oh, are we going to be on track or not? Because we can make a budget adjustment mid-year. So sometimes the budget committee will hear about that. Or we haven't ever reconvened to really fix the budget or whatever, but we'll do adjustments throughout the year to keep the budget. So yeah, just anybody that's ready to get engaged.
So when you go to the 5-person commission starting January 1st of 2027, and then you start that work of assessing the budget committee, who's on it, and expanding that by 2 people.
Yeah.
So what's that time frame kind of look like?
Well, that'll be up to the next board. The mix will be different. We'll have to practice being a 5. Well, I'm running, and I think I'll be there next year, but we'll find out. But if I was there, have to practice working together as a 5-person board. And then that question will be just early in the year, it'll be on the table. It's like, okay, this, agenda item, discuss about appointing the next budget committee member. So it'll be determined pretty quick in the year, but by that board.
Anybody else have any questions for Commissioner DeBone?
I just want to clarify, did you say you emailed this yesterday?
Just that PDF, that 6 or 8 page thing. Yep. Well, I CC'd back to her kind of announcement about the meeting, so hopefully it was everybody. I figured that was a safe way to respond and put it out.
I haven't checked mine today.
Okay, yeah.
Yeah, so yes, it was yesterday and he sent it, it looks like he hit. There's a long string of emails. You may not,
I think she's on there and I can resend it.
is that the CMC?
Yes.
Okay, so you should have been on there. So it was yesterday at 12:18 PM.
It was
And
sunny.
there was a second document.
Yeah.
Happy today. So as I say, if we start doing our homework, we can go, if anybody asks it. Yeah.
I'm curious to hear, like, what were your takeaways about how this process this year differed from other budget process years, or what was it like to be part of it? I know a lot of the meetings that I'm in now are talking about the upcoming fiscal cliff, but was that like an overtone in the process, or how did it compare to other years?
So, yeah, I mean, thanks for asking. It's interesting. We are in different times right now. Measure 5 and 50 are this tax structure of Oregon, the 3% in increments of our private property tax bills that come out. I remember 2008-9 recession. There was a subset of properties that their bills went down because the value of our properties went down. Mine did personally. I was living in an old manufactured home down in Lapine, and it went down by like $100 one year, and then it went right back up, of course. Not everybody did that, but it did. I was like, oh, look at that. It adjusted for itself. But so Measure 5 and 50 aren't structurally keeping up with this inflation boom we're having right now, right? Last couple of years, interest, inflation, wages have all gone up. Wages are sticky, so we're not probably going to go backwards. And the growth path that we have in Deschutes County kind of covers for the lack of that tax system keeping up with it. So we're in a comfortable spot in Deschutes County relative to other jurisdictions is the message. Some jurisdictions, some cities. So right now you'll hear about city councilors resign or city manager fired. We just generically, we heard about that a little bit in the news right now. That's because there's no more money to be able to keep there's tough choices going to need to happen for some of these jurisdictions in the state of Oregon and, maybe other places. But the way our tax system works, the local taxes, the bonds for the schools, the library bond, just the operating special district bonds, it's going to be tricky. So, but it hasn't been like that for the last 15 years because of the growth curve. We were always ahead of it. We were always ahead of that cost of doing business. And now it's kind of caught up to us, but we're all in it together. The whole state, everybody's in it together. We're going to have to work through it. So.
How much of this budget, I'm thinking specifically for behavioral health, comes from federal dollars?
It's pretty much all of it. The state, I don't know if this is a state, do you have a feel for, does the state really add to it?
They do some, but it's mainly passed out.
So it's federal dollars, and then it's the CCBHC, as I say, we go down all kinds of paths here. There's billable hours for what we do, which, increment over time, so it isn't just one check all the time, but there's systems in place, but it's mostly just federal dollars that we're, serving the people with. But see, you're already more informed. That's good.
Any other questions from the folks joining us online?
I have just a rather naive question. Is this normal for the states to pass through federal dollars and not necessarily ante in state money? And what does that mean? Is that typical, or does that say something about the state's commitment to these endeavors?
So I can speak at a high level real quick on this, and I'm not going to be an expert anyway, but what it is once the federal government sets up a funding structure or the scope and scale of how many dollars are going to be sent out to the states by population or Medicaid coverage levels or whatever it is, then the state implements the system of how it's allocated and who it goes to, because Oregon has the CCOs, the community
care.
coordinated community care. Yeah. Are you?
We're associated with it, yeah.
Yeah, I lost track of what I was even saying. But yeah, so the states set up the systems, basically, you can say it generically. And then we fit into the system. So that's how that goes. But when it
Okay.
comes to, do other states add money to that system? I haven't studied that, I guess.
Okay,
Shannon,
thank you.
Yeah.
I know as much as you do on that. I mean, every
We'll call our
state,
senator.
yeah, every state is different, but structurally they're set up similar in
Yeah.
terms of the states get federal dollars, there's a system that's in place, and then they filter out to the communities. And so you'll hear CCO consistently, CMHP consistently. You'll hear, state organizations like OHA consistently, regardless of state. Now, whether those states contribute more, I can't speak to.
So this is going to be a tumultuous time though, because the money is going to be different. The federal government's just acting differently. Obviously, we see it in the news, and the state's going to have to respond. So it's good for us to be up to speed a little bit about, okay, well, where is the money coming from? Are we Deschutes County servicing the people we want to service? And this is what we're talking about today. That's the domain of this committee, is making sure that with the resources we have, are we getting to the right people in the environment we're given, right?
And I will say, just to clarify, the state does contribute. They just do it differently through grants, right? So we are the beneficiary of $6.1 million or $6 million for our children's psychiatric facility. 3 million of that is through OHA. The other 3 million of that is through Oregon tax dollars. So to say the state doesn't contribute is unfair.
Yeah.
They do contribute. It's just not a guaranteed amount every time, right? Does that make sense? So the state does contribute through special kind of, projects and whatnot.
So it sounds like there's an opportunity to showcase what the state is doing and encourage them to do more if we want more.
That's right.
Potentially.
We'll go to Salem together sometime soon.
Okay, that's all. Thank you for answering. I was curious.
Anybody else? And the budget documents, I know you sent us a snippet that's applicable to behavioral health, but we find those on the Deschutes County
Absolutely.
website. They're all there.
Yeah, just a few clicks in, Deschutes.org, go to the Treasurer Finance tab, and there's will be a budget on the left, and it's about an inch and a quarter thick document when it's all published. So I just pulled that chapter out, but it's a PDF, so you can just go to page 437 or whatever we were looking at, and that's the same page.
Right. All right, so I'm gonna loop back around to the earlier agenda item to approve our February meeting minutes, because we've got Cameron and Lee that have joined us. Before I do, Dana, what is the status for Captain Schultz? Is he still on our board technically, or is he off? I'm just trying to figure out what our membership is so I can measure our quorum.
Yes, so I emailed them 2 days ago just to on that. They haven't heard back. So we're at 8 without him.
8 without him. Okay, and so we have 5, so we have easily meet our quorum. And so I think Dana has emailed out our meeting minutes from February 2026. Hopefully you've had a chance to take a look at them. Do I have a motion to approve those minutes?
I make a motion to approve the minutes.
Is that Cameron?
Yes, but there might have been somebody speaking at the same time.
Commissioner.
I'll second it.
But I don't know if you can, if it's like.
Oh, yeah, if I'm not.
I don't know. I mean, do I have a Carrie seconds? Okay, Cameron moved, Carrie second. Do we have any discussion? All of
Question.
Huh?
Am I ex officio or a voting member? I guess I never thought of it like that.
You're a non-voting member.
Yeah, okay, I'll keep my mouth shut during these votes.
I should have known that.
Wants to, I got told the same thing a long time, so.
Which is fine.
All right, all those in favor of approving the minutes from February, say aye.
Aye.
Any opposed? Motion carries. Okay, now that we have that out of the way, we're gonna move on, and thank you, Commissioner DeBonne, for that. That's terrific information for us, and I really appreciate your activism in this group.
I
It's
tried to vote when I shouldn't have.
no, I appreciate your effort to do so, and maybe you can, I don't know. We'll look at the bylaws, but I do appreciate your getting involved. It's nice to have that. So we are going to move on because we have some esteemed guests here, Tom Kuhn and Colleen Duzinski. And they are from BHAB, which is the Public Health Advisory Board. They do the same thing that we do on the public health side. They do it a little bit differently, but there's a lot of opportunities to collaborate with them. So I'm really pleased that you guys joined us today. Sorry, we don't have a little bit of a bigger group, but we've got 5 of us. And it's a good way to start off talking with you guys and improving our relationship and doing good work. So I'm gonna turn the floor over to you and just let us know what you want to talk about.
Thanks, Melinda, and thank you so much for having us. I'm Colleen, the chair since December of the Public Health Advisory Board. Your parallel partners meet in the same room on different days and have Chipotle lunch also.
Looks familiar.
Yeah. Tom is our staff liaison and coordinator of FAB, who makes everything happen and has for the past 12 years.
Going on 16.
16 years. FAB at this point, I think thanks to Tom, is a fairly well-oiled machine in a lot of ways. We, like you, have a group of 10 board members who represent about half clinical providers and half community-based organizations and higher education involved in like workforce development. Commissioner Chang is our Board of County Commissioners liaison, and we focus on convening and educating a group of providers who operate in or adjacent to public health, which, as I've learned, is a really broad community impactful definition that touches clinicians, community, social determinants of health. So we have presentations ranging from like epidemiology, healthy schools, hearing from Planned Parenthood, hearing from an organization like mine that focuses on homelessness. We also advocate at the state level by submitting testimony in alignment with Board of County Commissioners' priorities, and we'll send out action alerts to our members so that we can each submit testimony on behalf of our own organizations as well. And another thing we've talked about doing in our last, we have an annual retreat in November. One of the priorities that came up there was to both network better within our own membership and to formalize how we learn about each other and how we learn about how each of our organizations interfaces with public health and where potential overlap and redundancies exist. Because as we're entering tighter fiscal era, we need to identify who's doing what in the community, because as funding is pulled back and tightened, we need to be able to tap into the resources beyond just county and beyond like the traditional actors in some senses. So we've been trying to do that by having at each meeting a presentation by one of our members that answers both, like gives a broad overview of what they do and also answers a couple questions like what's on your horizon, how do you interact with public health, and like if they're touching certain areas. Another thing that came up at our last retreat and has been mentioned in the past was a desire to have more interaction with behavioral health. So to that end, our purpose in being here is one, just to say hello and get some FaceTime, let you know that we exist, and also to extend an invitation to, if you would like to attend, our meetings are also public, but if you want like an actual invitation to join, we thought that it would be appropriate to join our May meeting. In part because the topic, one of the topics on the agenda is a data presentation by the, you'll have to correct me.
Anna Woodbourne, no, it's Anna Woodbourne, who's our overdose prevention and response strategist. And she's going to be doing what they're calling drug overdose prevention presentation, mostly around data. Our epidemiologist, Matthew Christensen, in the past had for a couple of years in a row provided us with updates, and Matthew is no longer with us, so Anna's trying to pick up where he left off.
He's still alive.
He's in Colorado. He's in Colorado. Thanks.
And so that is, we can send out the actual invitation Tuesday, May 5th. It's virtual, I think.
Yeah, it is virtual. We're like the Behavioral Health Advisory Board. We're on the commissioner's website with lists of meetings and so forth, where you can access the virtual link.
It sounds like you guys alternate in person and virtual.
Yes.
And how many meetings do you have a year? Do you do it monthly?
10 years, so it's about half and half.
Skip the months when everyone's busy, like
Yeah,
July and December.
No, July and January, because the New Year's Day and Eve. And also in July, nobody shows up, so.
So that was one intention or two intentions of being here, introduce ourselves, invite you to May. We also wanted to highlight our Health Heroes Awards, which has anyone ever participated in that or been to? So I'm gonna pass it on to Tom to explain what that is.
I've attended, yeah.
Yes, yeah, Commissioner DeBonne, who's started just around the same time I did, quite a while ago. And these awards have been going on since 2005, actually, so even before my time. And it's kind of evolved over time, and it's changed the way it's been done. But for the most part, it's identifying an individual or an organization that we feel demonstrates excellence in public health, but it's also been open to persons and organizations in the behavioral health field as well. I passed out our nomination form, which we send out, and you might have seen one of these, might have came across your desk, because Central Oregon Health Council, we usually send it out on their listserv. That's been our primary method of getting the word out. And so, as I said, the organization or individual can represent behavioral health or public health. We have some criteria in who can be nominated. Like, we don't want advisory board members nominated because that had happened in the past, and then we thought it was kind of like we're just awarding ourselves for good work. So we don't do that anymore. And anyways, over the years, we've had involvement from the Behavioral Health Advisory Board at times, and then sometimes not. We have the Public Health Advisory Board decide who the winners are of the awards through a vote, basically, where they all get to see their applications, and then we just do an online voting, and whoever gets most votes gets the award. And we were talking about this upcoming year, once again, joining back with the Behavioral Health Advisory Board in doing the award. And we have some ideas about how that could look this upcoming year. There was times where we'd have both Behavioral Health Board and Public Health Board all vote on the winners, but we kind of switched it back to just a Public Health Advisory Board because it almost got a little too complicated when we had both boards. Not saying that would be the case now, but at those times it was, so we switched back. But did you want to discuss some of our options we were talking about?
Well, before that, I was also going to just say what the structure of the award is that we have a afternoon event. I think next time, or this year, it's going to be on May 5th is our meeting.
Is it June
Tuesday,
3rd?
June 2nd.
At the bottom down here, it's acknowledged.
That's last year.
I'm sorry, this is 2025.
Oh, got it, sorry.
We don't have the same, we don't have the
June 2nd.
nomination and format process yet, so that'll be
June 2nd.
Tuesday, June 2nd. And we have plaques made. We generally have some media there, local electeds. There's usually a pretty good crowd. And the person who nominated reads their nomination, which says all kinds of great things about how amazing they are and how they've served the community. And it's a really great opportunity to elevate and highlight and celebrate the folks who are often operating in the background and don't get that kind of public recognition. So it's a nice event. It's very simple. And then there's like a lunch at the end. And if anyone wants to stick around and chat and have lunch, we do it outside somewhere in a park. So the invitation we wanted to extend to your board this year is if you would like to join us for that and have a separate process, you can adopt our own nomination process and decision-making process. And we would just have like a joint awards ceremony. So kind of expanding what that looks like and having a behavioral health focused award. And we have like the public health focused award and celebrate everything as the health heroes. But we're just, I mean, it's an ask. There's some logistics and some things that have to happen. But we like the idea of highlighting behavioral health too, and like allowing that form to take whatever you think is most appropriate.
And that's just an idea being thrown out.
Yeah.
And note, many of the winners are behavioral health agencies and individuals.
Even if we're not, it's.
Even if you're, it's, so it's not like it's always just been public health. It's very often behavioral health.
would you guys be okay if we cribbed on your work to get up to speed on?
Yeah.
That's why we're here.
Yeah, okay.
So we could keep it the way it is, but just have more involvement from the Behavioral Health Board or voting this year as well.
To having an additional award.
Yeah.
What is your deadline for nominations if you stay right now? Because this one says April 11th.
Yeah, no, actually,
Really fast platform.
yeah. So I'll start working on, first off, updating this form. Please don't distribute this form because it's outdated. And anyways, I'll get working on going on it. It's just the sooner we can get moving on it, the better. And yeah, and then we can have work through Central Oregon Health Council again. If they're still willing to let us use their listserv. And yeah, it's not too complicated. We will bring it up at the advisory board meeting coming up here in April as well. So we probably will do that.
So imagine that like mid-May, would that give you enough time to get the plaques made and invitations out?
Oh, as far as like when
Yeah.
we announce the winners?
Yeah.
Yeah.
Or like when we need to like work back into a deadline for nominees.
Yeah, nominees will try to get done by early May, I would say.
It's a little bit more time than this April 11th that's on the
Yeah.
last year's. Because
Yeah,
I'm just trying to backtrack and see, do we need to take action at today's meeting to decide which direction we would like to go in order to give you guys direction for your own award, and then if we're gonna do our own, join with you, but have a second award for behavioral health, we probably need to get moving on that as well, and I would work with you guys to coordinate that. It sounds like those would be the next steps.
Yeah, I think that would be the next steps. And just to be clear, I think the nominations for behavioral health should go to your board and you just
Right.
give us the name. Yeah.
Yeah, no, I just wanted to, I'm just trying to figure out if we need to vote on that at today's meeting, or if we can wait till the April meeting to make a decision, since we have kind of light numbers, and it looks like we just lost Lee also.
I'm a little worried that by waiting till your April meeting, which I'm assuming is like the third Friday, that we're almost into May at
That's what
that
I'm worried
point.
about too.
So it would be good to know a little sooner than that.
Does it need
Right.
a formal-
What?
Does it need a formal vote?
I tend to use votes just to,
Could do an online vote too. We do that in public.
I know you do. I don't think, I don't feel comfortable with that, only because I know too much about public meetings laws from my job. It's just, I know it's one of our issues that makes us a little less effective on our side, probably.
Or we could vote now and just contact the people that weren't here.
Yeah, well, I think that if we have 8, we now have 4, so I think that, let me look at my bylaws, I think that's a quorum.
Probably 4 plus 1.
4 plus 1, yeah. So I wonder if I could get Lee back on the line. Is there any conversation, if you're okay, I know you guys probably have some more to talk about, but I think this is a good time to get our feedback from our members. Such as there are. Cameron, Linda, Carrie, do you guys have any thoughts about this Health Heroes and the direction that we want to go in?
I support it.
Sounds
Good.
Yeah.
Like, do we want to do our own kind of nomination process for the behavioral health side and then partner with our BHAB friends for the overall award?
Then it would be like 4 awards, 2 individual awards, 2 organizational.
Oh, I didn't, okay.
Yeah.
So,
I guess I don't know the proportions of behavioral health awards that have been given for the heroes, because it seems almost like duplicating, but I love the idea of it. Like, I guess originally because I'd heard about this and I was thinking it was more like general health, and then maybe we would do some. I thought it would be interesting to do something for more behavioral, but again, the concern about duplicating, but to be involved in some way, I think makes a lot of sense, and I really support this. I think it's a great idea.
Yeah.
Yeah, Cameron, I think you're right. There's a small element of duplication here, just because it's inherently hard to really draw a strict line between what is health and what is behavioral health. I think in my mind, the benefit of having duplication is just celebrating more people and teams who don't often get that kind of recognition.
Yeah, that totally I mean, if everyone's okay with that, I feel good about that.
Yeah, I don't think this is a particularly heavy lift if we do our own nomination process for a organization and individual, because we're just gonna crib off of what you guys do for this first time around. I think we probably will for the, you know,
You
probably
probably
years.
celebrate nominees. Not winners.
That's really funny. That was a topic of our chairs meeting yesterday.
Okay.
We don't currently have a process for that. BHAB just recently like kind of formalized our membership and had kind of like a rebirth and formality. And we've had a number of new members. So our thought was, so the short answer is no, not yet. Longer answer is we would like to do that next year.
I think there's value in that too, like even if you don't win, just being acknowledged for like, wow, somebody put you in for this, right? It would be cool, and I think, you know, we could, it's kind of a PR thing, but like bring awareness to this group, and so.
Yeah, we pretty much just we have the award ceremony. The media is always there, at least somebody's there,
They
and
would publish the number.
We don't publish nominees.
No, we don't.
But I think
yeah, just the winners.
we should publish nominees and celebrate nominees.
Yeah, no, but the media, I think would, if we gave it to them, maybe they
Yeah.
would link that or something.
Yeah, just not put them in order, like who took second, third,
Yeah.
you know, just say here.
So do that.
The following,
That's all.
were also nominated.
Yeah.
We could do that.
The one thing I could see being confusing is to the community, knowing where to direct their nominee. Should it be a public health or a behavioral health nominee, especially with community-based organizations? Like if you look at some of our previous winners, it was like the Lighthouse Navigation Center.
Yeah.
Or,
What's that?
How would you suggest we navigate that then? Like if we were to get like a public health side, or you got somebody from behavioral health side, would you forward it on to us and we would just sort of?
I think that we may need to have like an offline meeting with a couple of us from each team so that we can figure out how to thoughtfully add a question that would help differentiate between the two.
On the application.
That's what I would say on the application, is actually the submitter be the one that defines that. Are you submitting as a behavioral health award or a public health award? Or
And making sure it's really clear.
Yeah, so then it's not like, oh, we did it.
Yeah.
Right, like the submitter is the one that's doing it. I'm just a big fan of.
Like Lighthouse, public health staff and behavioral health staff interface with them. So I don't know, like that examples.
So Lee just joined because his internet had died. So he's back on. We now have a quorum and I want to catch him up real quick. Lee, can you hear me?
Yeah, I can.
Okay, and so Tom and Colleen were talking about the Health Heroes Award and collaborating with BHAB. And one of the options is that BHAB we would partner with them for the whole thing, but we would have our own nomination process for behavioral health side, and they would do public health side. The event would be the same, but we could crib off of their nomination forms and the information that's going out, but we would handle sort of our own process to nominations for behavioral health, an individual and an organization. So there would be 4 awards. And then the alternative would be
To just have 2 awards that's just
combined.
general, public, or behavioral health.
Yeah.
Doesn't matter if they're, which one they are.
Yeah, so we would go stay with 2 awards and we would work with them on the process, or we would go to 4 awards and we would kind of run our own nomination process. And the deadlines are coming up quick because the award ceremony is on Tuesday, June 2nd. And so backing up from there, I feel like we need to sort of make some decisions at this meeting rather than wait until the April meeting. And so that's kind of where we're at. We've had some discussion about it, and it sounds like everybody's sort of on board with either of those options. I love celebrating more people. I mean, there's plenty of people out there that are deserving of recognition like that.
Can I just add two more pieces for context? I think a reason to do more awards and separate is because voters sometimes will just vote for like their field, just naturally. And I think that, oh my gosh, I lost my thought.
And that happens often, that people will not self-nominate. We ask not to do it. Criteria, but they still do every year.
And you guys, your board has designated slots from different professions, which we do not have. We're from We just have to have lived experience by at least 50% of our members, but other than that, we don't have seats.
And our board isn't statutorily required to exist.
Yeah,
So I think that's why we're able to add the seats.
yeah.
I was just thinking, and maybe I'm not understanding of who does the nominations, but I guess that's one of the concerns of where, regardless of what happens, that for this group, I think it'd be great to have more information on just how to do nominations, how to get the word out to folks in behavioral health, because this is not something that I think our group has ever talked about, even whether we're involved or not, that it exists with a FAB. So that's one thing that I would request. And then two, the idea of having clarity for folks who do nominate of what's behavioral health versus what's a health nominee, and how do we, how is that clear? Because I understand it could be up for the person who's doing the nominating, but even if I were to nominate, I'd kind of want to know, oh, which box should I check? So is that easy to tackle, or is it something that we participate in
But
navigating?
that's kind of what you had an idea of a question on the nomination form.
Yeah.
And maybe you could add some information to kind of say.
Yeah, what
not
each
guide
means.
nominate
Yeah,
or-
we definitely could add boxes, is this public health or is this behavioral health? I mean, that could be done, but
But also just
How-
even kind of like what's under each of those umbrellas, because it could be a lot of crossover, just like with your example of the navigation center or somebody from Mosaic, like just a few, like just like a couple lines of like what this means for, for examples of behavioral health or examples of just general health.
We could
I think that
probably
would be helpful.
resolve it if there is remaining confusion, even after we expand
Yeah.
this a little bit, we can probably resolve that. Go back to the nominator and say, hey, we collaborated together and we feel like this might be more appropriate for behavioral health. Would you like us to switch your nomination to that? So we can probably manage that.
It's also
Yeah.
maybe a good opportunity
I
for
ha-
education.
I have my hand up
Yeah,
whenever it's
I see you,
appropriate.
Linda. I see your hand up, but we're
Okay.
finishing this part of the conversation first. So I'm sorry,
Okay.
Colleen, what were you saying?
The education piece that Cameron is referencing, and having the nominee, I'm sorry, the person nominating be able to differentiate between the two. There's just like an opportunity for community education, both in giving examples and defining what each of these scopes are. And there is fuzzy, like it's not a clean overlap. There are whole like departments that just inherently straddle public health
Yeah.
and behavioral health.
and maybe that doesn't really matter either. Maybe we're just saying you're getting the behavioral health award this year, and maybe
What if we had a health services award? I'm just saying.
What?
A health services award, or health award, right? So we have a big public health and behavioral health and a health award. For
Yeah,
those.
we
It
could-
kind of is like a default that could,
Yeah.
could
no,
straddle either
there are
one.
a number of agencies that cover it all, right? And people that cover it all, so what if we,
And maybe one clarifying point is that I think we've been saying organization or agency, but that also could be team.
right, and so, I mean, what if we just left an option for that instead of trying to like make somebody who does it all fit into one or the other? Like,
we actually did at one point when we were doing this more with Behavioral Health Advisory Board in the past, just call it Health Hero Award, not Public Health Hero. We kind of went back to the public health. 5 or 6 years ago, the leadership decided, let's make this more public health.
Got it.
So we can change it.
That's probably something that your FAB would want to talk about if you want to adjust. I mean, I think we're grateful to be included in this and to collaborate, but we're following your lead. So if you want to change the nature of the awards, it's probably something that I would like we take your lead on it, I think. So Linda, what's on your mind?
Well, my comment, it sounds like this is where the group is ending up. I don't know this first year if we have to be perfect about all the boundaries. I think if we do it with good faith and good hearts, it may work itself out. But the other piece is, I'm not sure we can cleanly separate all of it anyway. Health is an integrated process, whether it's behavioral or public or middle or whatever. And I think that's part of, I mean, it's a blessing, but it's also a confusion when people are trying to navigate the system. So my thought would be do the best we can this year. If they want to, call it health heroes and not split between public and behavioral, that might be part of our process in helping the public and getting more clarity about our boundaries too. I mean, it could kind of work both ways, I think.
So I guess I would propose this. I would like to have BHAB vote if we want to go ahead and work on this to collaborate with FAB. And then I propose that you delegate authority to me or Lee, to work with FAB leadership to kind of massage out exactly what this looks like and get the nomination process underway. Not every little thing has to be a vote, but you can certainly tell us what you want and we can work with you guys. Cameron, do you have your hand up? Oh, you're
No, that was
clapping.
just I was applauding you. Thank you.
Okay.
Well said. I'm in
Any
full
other
support.
discussion about that from BHAB? All right, do I have a motion to authorize Melinda and Lee to work with FAB to collaborate on this Health Heroes Award in whatever form that looks like, and to get the nomination process underway if we're doing different separate awards? Yes. Harry, you have that motion in those exact words. Repeat after me.
No,
I'm kidding. Do I have
Write it down for me and I'll.
Okay, well, Dana's got it. I'm relying on her. And do I have a second for that?
I second.
Cameron seconds. Okay, do we have any further discussion on that? Okay, let's vote.
I just wanted to say thank you so much for bringing this. I think this is really exciting, and it's like Shannon says, the more we can celebrate people who are doing great work in public health, the better.
I agree. I'm excited about this. I'm excited to have you guys here, and I feel like there's so many other ways that we can collaborate too. So, okay, so let's take a vote. All those in favor of the motion, please say aye.
Aye.
Any opposed? Say nay. All right, motion carries. So good. We have a new collaboration, and then we will be in touch, kind of tease out the details on this.
Mark your calendars for Tuesday, June 2nd, midday.
If we're going to do this, I would love to see full participation by BHAB.
It is a well-attended event. The last few years have been at really big turnouts.
We're about to double our turnout.
Yeah. And we can and those of us on BHAB can make nominations. We just don't nominate ourselves. I think we're just going to follow your rules
Or health services staff.
or health services staff. Okay.
You try not to.
All right.
Unless we try to keep it so it's not so.
Not county. Yeah. Yeah.
You know, now if somebody from the community did that, that's okay, but just not for our board members.
Sure.
And our staff to nominate each other, because that's happened in the past where we had a bunch of staff nominating each other.
Use like a rating scale, like how do you pick your winner?
It's not like ranked choice, and it's not a matrix. It's just this one.
They fill out we sent out the applications for all the members, and they review them all, and they just pick the winner.
I think it could be tightened. I would say we should take notes this year. I've got a framed sign next to my desk that says done is better than perfect. And I always have to remind myself of that. And I think this year might be a done is better than perfect.
Sure.
Yeah.
But I
It
agree.
makes sense. I just was curious if you get lots of people that are, well, that kind of rule of like, no, you can't nominate yourself, but clearly like nominate.
Part of the reason I ask for so much lead time on these things, I have to beg people, would you please vote? Like it might take 2-3 weeks just to get everybody to vote. That's why making that process more complicated hadn't been something we looked into.
One thing just occurred to me is the cost of the luncheon and the cost of the plaques. We're going to collaborate with you. We're going to want to share, but we don't really have a budget, so to speak. And so we'll figure it out. Okay. All right, cool. And then I'll work with you guys to get a deadline on when you need to know what our awards are, and Lee. Okay, I'm excited.
Yeah.
Anything else that you guys want to share with us from FAB side?
We so appreciate you. Thank you for inviting us here, and thanks for working together on the Health Heroes. And thanks online folks.
Budget wise, Tom, what are you thinking? Just so I have an idea.
Well, we usually budget lunch for 30 is what we've been doing. And then the plaque, I can't remember how much the plaques are, but they're nice wooden plaques, and so it'd be at least 2 plaques. I'd have to look how much.
If you look, just shoot me an email of like what it cost you and what I can
Yeah.
estimate up. Thank you.
Those are the only costs,
Yeah.
because the park and rec facility is usually free.
Yeah, so like $600 for lunch and. So
How
1,000.
much those plaques are. Okay, I'll email it to you.
Thank you.
How do you guys get out these forms? Like, what's your process for,
Gwen and
Council.
Mary and her team.
okay?
Yeah.
But we can send them out too as individual members,
Yeah.
you know, to try and encourage people to,
Although most of the people are on that list, I found.
yeah.
But there's more.
Brainstorm about how to make a really clear one pager.
Yeah.
Yeah, well, we can brainstorm about.
I'll
the
work
actual
with you guys on that. Okay.
And the COHC listserv I know is very evenly matched with all kinds of providers from different fields.
One last thing, is yours come out of your public health budget?
Yes,
We'll get a petition Holly to pay for it.
comes out of the public health director's budget. So that
It's
would
a
be,
health thing now, so we can petition Holly's budget.
okay.
Shh, don't put that in the notes.
Good text her.
I'm kidding, it'll come out of probably BHAB, but she, as you were saying, you know, it's maybe not perfect this year, but she might want to be a part of it, especially if we did like a health. At some point, ever did like one for that.
All right. And that may be this year. We might talk about that. Very exciting. I feel like our board's actually doing some stuff, good stuff now. Okay, so we are a little bit ahead of schedule. 4 minutes. I'm gonna turn it over to our friends, Mary and Gwen from the Central Oregon Health Council.
Okay, in the spirit of continued collaboration, we wanted to continue the discussion about this idea of a RIP 101. We had talked initially about having the RIP 101 for the BHAB members. Then we talked about extending the invite to FAB and potentially the folks from IDD to really look at what are potential entry points where your committees as individuals or as a coalition of committees could look into supporting the objectives in the RIP or the Regional Health Improvement Plan. So Gwen has led several of these sessions with individual members of organizations who have come together to learn about the RIP, to look at the content of the RIP, just kind of at an introductory level, and then go through some activities to assess, okay, where am I and or my organization potentially ready to collaborate? Because the whole purpose of the RIP this time is we're bringing together organizations, people, committees to pool our resources, just like Colleen was saying, and in a time of more limited resources, it's even more important to do this together to carry forward the goals for regional health improvement that our community members identified. So our question for you is really to make sure that we give you the content that you want in that session. So we have a little bit of a proposed agenda and then are just looking for your feedback to see if it hits the mark, if it doesn't hit the mark, so that we can sort of craft it and bring it forward as something that's actually useful as you go through identifying what your goals and action items are.
What are your burning questions? Yeah. It's good.
So just very generally, the agenda that we put together was sharing a little bit about what is the Regional Health Improvement Plan. It has looked a different way in the past than it does now. So giving a little bit of shared context about what does the RIP look like now and why is that? And where did the information within it come from? The second thing would really be looking at potential entry points for your committees. I talked to you a little bit last time about the big health topics, which are sort of the umbrella. Then we have the strategies. And then at the even more granular level, we have the objectives. And then we thought we could work together with potentially us and Michaela, who's one of my colleagues, who's a member of FAB, to look at, okay, are there pieces of the RIP that seem like they could be good entry points for aligning with the work that we're already doing. So the purpose is not to give you new or different work. It's really to look at what exists within the RIP that could align with what you're already doing or want to be doing. So the question, I guess, is, does that feel like it aligns with what you want to get out of it? RIP. How could we get involved in the RIP, and some suggestions that we could bring to the table of what that could look like?
Or is it way off? Because it could be way off too. So there's no wrong answer. And like burning questions for folks who've been around for a while and more involved. So yeah, please share.
One initial question I have is and for context, this was floated to FAB and FAB was like, yes, we would love to be part of a RIP 101. But I don't think that I gave a whole lot of information because I don't know that I had the information to back up that invitation. So one burning question that I have is, would we be participating in this as representatives of our employers or as a committee or somehow both?
The both is always a hard question. I think as the idea came out, it came to be because BHAB has in their bylaws that part of their work is to implement the RIP. So the idea for BHAB was really as a committee, RIP be a tool to kind of guide it forward. But we read through the bylaws of FAB and it's a very different scope within there.
That being said, there's things FAB is probably already doing that is in the RIP. And so let's do, get 2 for points for what we're doing in the region. So I think the original intent was to come as a coalition to look at coalition work. COSPA has done the same. And we're still our other selves with our other organizations. So it's still, oh, wait, I can see where my organization A or C could plug in here too. So it can serve dual purposes, but I think some of the task potential would be the coalition.
It's a good question because we don't have the same seat structure as you guys do. And so I don't think we're really set up like that, but you guys might be. So
I had a question in regards, and I should know this, but I've just been not in other subject areas recently. Are the RIP work groups meeting regularly? Are those same established like in the
No,
past?
so that's one of the big differences, is that the work group structure is shifting.
Okay.
And so we're looking at different structures. The RIP is structured differently. So
Okay.
how it's implemented is going to be done differently as well. So, that's something that we could touch on as part of the entry point and, with the knowledge that we're building it as we're trying to fly it too, like a lot of folks. So.
Okay.
So, have we, touch on that. What does it really look like?
Yeah.
your proposed agenda aligns with what I was thinking when we met, Mary, and when we talked last month. Linda, Cameron, Lee, Carrie, do you guys have any questions about this? Any suggestions? I suspect that we're all kind of newish to RIP. And so we're probably probably don't have enough information to have a lot of burning questions in addition to what Colleen had and Tom. But I think that's a great starting point.
Yeah, that's a great starting point for where things are now. I'm familiar with the RIP from the prior models from some school internships and things a few rotations ago. So hearing how it is now would be really cool, and how it fits into the bylaws and our ability to support it would be great. I think that's a great starting template.
I agree with Lee.
Linda, how are you feeling about it?
I'm good with this.
Great. Carrie?
Yep.
Awesome.
Okay, sounds great.
Do you have a timeline, like kind of just, I know you haven't set a date yet, but.
I mean, initially we had talked about May,
Yeah.
just as you work through some other, identity questions in the committee, but that can also be flexible for us.
You can do it whenever works for you all.
Okay, I think we're probably gonna kind of put a little bit of a pause on our menu of options for what we want to be when we grow up, because Lee and I were talking this week that this collaboration with FAB and this work with RIP is kind of gonna drive that. So to try and figure out what we're gonna be when we grow up, right now, it's like we're kind of bypassing our teenagers.
Makes sense.
That's the way I'm looking at it, but, so. Having said that, May seems fine. I don't know, you guys, this is kind of a collaboration with you guys too.
I know that scheduling with our members tends to be challenging because half of them are clinicians and they usually need a fair amount of lead time. That's the only consideration I would add.
So we could find a date, right, like in this next week or so and get that out. Is that enough lead time for them, do you think? Or are you thinking pushing it out a little bit further into the summer?
I'll defer to you all. I think mid to late May. Once you start pushing too far into summer, everyone's on vacation.
Yeah.
So I want to be
Yeah.
conscientious of that too.
So let's look for May dates. Are you thinking like, how many hours do you think?
We can work with you on how interactive you want for the, like, exploring for BHAB partnership. The RIP 101s, we've kept it an hour and a half. I could probably tone it down. COSPA was a fraction of that, so
It seems so. I mean, an hour and a half.
I don't think we'll need that much time.
I don't feel prepared to kind of guide, put and give you input. I
Yeah.
want you guys to
Okay.
tell us.
Six, yeah,
What,
an hour.
Yeah,
an hour?
because I don't know the numbers of people that always plays into all the logistics. Yeah, an hour.
And
We'll
then-
make that.
And on the agenda, would there be a discussion of like next action items? Like what do we go forth and take from this and what do we do next?
Yes, so the hope in the sessions that we have had is really they feed into a next step. So it wouldn't necessarily be us directing you to a next step, but the hope would be you all leave with some sort of tangible idea of, okay, we're gonna take this back to BHAB and this is the item we're going to discuss. Or here's a potential entry point for BHAB and FAB to work together, and now the committees need to discuss that with each other.
Because what I'm thinking is maybe an hour and a half would be better, just because that will give us a little time afterwards to have some of those preliminary conversations. Because once everybody disperses, you know, the momentum, you lose that momentum a little bit. And so I guess I would think an hour and a half.
It would be great to leave there with some concrete action items, both like on our end, because I don't think that we're gonna be able to convene a second meeting. Like,
Yeah.
this is it.
Yeah, and I'm thinking that might be the same for us also, with the exception of the health heroes.
And then it might be taken on by like a self-selected work group.
Yeah, subcommittee kind of thing.
Yeah.
Okay.
Great, sounds great.
Get what you need from us?
Yes. And if anything comes up between now and the next time we talk about it, always feel free to send questions along, but
You'll start looking for dates and propose them to us, and can you do a group email that includes Colleen and Tom, and like, and you've got Lee's email address, I've got yours now, so if we can kind of establish a group email address or thread, that would be
yes.
good, and the sooner we can get a date nailed down, the better. Is noon generally better for your group?
I think it's I don't know that there's a pattern. I think.
When is your May meeting? You must have that on the.
May 5th. We always meet the first Tuesday at noon.
Okay, and ours is the third. When is our meeting in May?
Third Friday.
You know that better than I do.
Figured it out.
Just look at my calendar and like, oh, we have this week.
The 21st. No, that's wrong. The 15th.
The 15th. And so you guys are thinking about this will be your May meeting for FAB?
We already have our May meeting agenda set, so this would be fully separate.
Oh, it would be, okay, I thought
Yeah.
I misunderstood you then. Okay. All right, so,
We could have it on the agenda, absolutely,
Yeah.
like give a preview or
yeah.
we could recruit April too. We can touch base with Michaela.
And is the idea, like, what's your person limit? Because I'm just wondering if there's room to invite other people that maybe aren't on FAB or BHAB.
We have done upwards of 30 folks in our RIP 101 session, so it's more space.
That might get at the identity question again, because inviting folks who
Depends
don't
on-
represent either
Yeah.
that would be could dilute just the impact of the committee next steps would have.
That's true, yeah. Okay. And how many people do you have on FAB? How many people do you have?
Right now we have 13 members plus one that's another person coming on, so you could say 14.
But they're very busy people.
Yeah, if it's a nice Friday afternoon like this.
Yeah.
Outside.
I'm not above a good guilt trip. We have fewer numbers right now. I think we've got 8, and I don't see a lot of likelihood that we're gonna add more than that between now and May. So I think we're hovering in that low 20s, maybe.
Very fine, yeah.
Okay. Okay. So we'll wait to hear from you on some proposed dates. We'll respond.
And I'll get those out to the group email and this next week.
Great. Okay, anything else from COHC? Anybody else have anything for the good of the order?
Should I just email the behavioral health board members the invitation to the May 5th BHAB meeting because it's virtual?
Yeah, that'd be great.
I could just do that and then you have the option to join because it's virtual anyway.
Yeah, and do you have the email list? Make sure.
Yeah.
Yeah.
Danny said it.
Okay. Yep, that sounds great. You had something.
Yes, I do. And I'm sorry I didn't tell you in advance, but I was gonna
No,
talk
it's fine.
about it. April, this room's not available, but I did reserve the backup room that we were in before. So we can either do virtual or upstairs.
You want to do a virtual meeting for the April meeting?
Why I have rooms?
Sure.
Look,
I won't be here in April, but.
Okay, so it might be a shorter meeting because we won't have a director's report unless you're gonna send somebody to do one. Shannon?
Yeah, I will have Amber Clegg that will be here.
Okay.
So,
Give her 10 minutes. That,
yeah.
Okay.
She might not have anything, but I would say at the most.
okay, how about we do a virtual meeting for April? Okay, it'll be virtual. And everybody note the new login credentials or
she has to.
do you need to, you'll remind people what the login credentials are?
Yes,
Okay.
I'll send
what?
out the new link and just let everyone know that it's
Okay,
virtual.
all right.
Yeah, it's the same issue.
Anything else? All right, this meeting is adjourned. Thank you, everybody.
Thanks.
Never.
So May 5th.
Thank you.
Thanks for you too. I plan on.
Yeah, if they're
You do.
not one of
Sitting back here.
regularly.